So thank you ever so much, everybody, for joining us this morning. My name's Dr. Julia Patterson, and I'm the Chief Executive of EveryDoctor. We're an organisation who campaigns for doctors, other NHS workers and NHS patients. And we're bringing journalists, MPs and the public together this morning to give a presentation on the crisis in NHS primary care. There's a lot of discourse about this in the media and from politicians at the moment, and we wanted to set out the situation with some statistics and bringing the testimonial from the front line, explaining what's really happening. We've got huge concerns about the situation, as have many other people, and we think it's really important to couch the situation in facts. So I'm just going to start with some really boring housekeeping for those of us in the meeting itself. I'll be really brief with those. This is a public briefing, so please be aware that anything said could be listened to by members of the public, other MPs and journalists. Thank you so much for taking the time to join us today. We know how busy everybody is, so we really appreciate your time. We've got a question and answer session, which will happen at the end of the presentation. So if anyone present in the meeting has questions, please pop those into the chat box. We'll be keeping a note of them and you'll have an opportunity to ask those questions at the end of the session. And like the million of Zoom calls you'll have been having over the last 18 months, we keep ourselves muted unless we're the current spokesperson, just so that we avoid kind of background noise and interruptions during the presentation. So thank you so much for joining us. Once again, we are EveryDoctor. We're a campaign group who represent about 1,700 UK doctors, and we speak to over 25,000 UK doctors every day in a forum that we run. So we're in a good position to tell you what's happening from the NHS frontline at any time. So I'm going to start now. So just to give you an overview of the current situation, there's been a lot of, oh, sorry, could you go back, Hannah, just so I can run through what we're doing? Brilliant. So I'm going to speak for about 10 or 15 minutes initially, and then we're going to hear from 3 of our EveryDoctor members who are GPs in the NHS, Dr Emily Ball, Dr Alison Hobbs and Dr David Mark Thornton, and then we'll have a Q&A session at the end. Could you move on to the next slide, please, Hannah? Thank you. Okay, so there's been a lot in the media recently about NHS primary care, and I'm certain that you guys will have read some of it already. Much of it has been very inflammatory. There's been a lot of accusations levelled at NHS GPs, and we're here today to set out the situation based on statistics. A lot of what has been written in newspapers recently has been factually inaccurate. However, the NHS is under enormous pressure, and we want to explain the context of this situation and what needs to be done to improve things. Prior to the pandemic, it had already been recognised that the GP workforce needed to be bolstered enormously. Jeremy Hunt, back in 2015, pledged to increase the GP workforce by 5,000 extra doctors, and he said that we'd get there by 2020. In 2019, Matt Hancock made a second pledge to increase the GP workforce by 6,000 by 2024-25. In reality, we're now 1,900 doctors down. We haven't achieved those goals. Not enough has been done to actually tackle this problem head on and support the workforce where it needed to happen. Could you move to the next slide, please, Hannah? So the NHS is lacking in GPs, and I wanted to explain why we need more GPs. In the UK in 2019, when this work was most recently carried out, there were 76 GPs in the UK per 100,000 people. And in some places, this fell to 54 GPs per 100,000 people. As a comparison, Cyprus had 105, Belgium had 115, and Portugal had 244. NHS GPs were extremely stretched even before the pandemic began, and certainly before any of the current discourse about GPs and telephones and insinuations of lazy doctors and all of the rest of it, which I'm sure you've been reading about. At the same time, while our GP numbers have been falling, the number of registered patients at the NHS GP surgeries has actually increased. So we've just included the raw numbers here. As you can see, in August 2018, there were about 59 million patients registered in the UK. And in August 2021, that figure had increased by about 2 million to 61 million patients. So the number of doctors is falling and the number of patients registered is increasing. Could we move on to the next slide, please, Hannah? Okay, so we're just going to explain briefly what happened at the beginning of the pandemic for GPs. Obviously, things moved extremely fast in March 2020 as we were all grappling with a new virus. We didn't quite understand very much about this infection at the time. And GPs received an email on the 19th of March 2020 instructing them to change their ways of working in order to keep their communities safe. Now, I won't read out all of the small print there. It will be part of the briefing notes, which will be circulating after the meeting. But essentially, GPs were asked to increase their home visits, which many of them did do, regardless of whether they were provided with safe PPE, which is a whole other story, but put GPs at huge risk during the beginning of the pandemic. They were advised to utilise telephone consultations to whoever could stay at home and be safely managed over the telephone. And they were asked to continue with face-to-face appointments with anybody who required one. And largely that is what has happened. We're in contact with thousands of doctors per day. I have not heard of a single GP surgery which has actually closed its doors, despite the accusations we see in the papers currently. Could you move on to the next slide, please, Hannah? GPs have been busier than ever. We've taken a look at the raw data, looking at how many appointments have been carried out over the last few years to compare where we are now with where GPs were a couple of years ago. So we took 1 week in August, the third week in August, and this was around the time that we were seeing a lot of these media attacks spring up. GPs actually carried out 250,000 more appointments that week than pre-pandemic in 2019. In addition to this, GPs have been at the front line of delivering the hugely successful COVID vaccination programme in this country. And that's something that doesn't get an awful lot of media attention at the moment. Back in December 2020, GPs were asked to set up the first vaccination centres. Certainly in England, they weren't offered any upfront funding to hire staff, and yet their gargantuan efforts are the reason that our communities were made safe. They are still running vaccine clinics in many places, and this additional workload is huge for many GPs in the country. What they are currently managing is absolutely enormous and incredible and should be applauded and supported. Could you move on to the next slide, please, Hannah? We've just included a couple of examples here of some of the attacks that have been made in the newspapers. EveryDoctor has been writing rebuttals to many of these because there have been so many factual inaccuracies. Other campaign groups have been reporting some of these articles for their inaccuracies as well, and yet there has been no response from any of these outlets responsibly reacting to the criticisms. It's extremely upsetting for the NHS workforce to read these, but it's also misleading and has been leading to huge problems on the front line with patients. There is escalating abuse towards NHS staff, and I'll come on to explain that more. But this sort of reporting is dangerous and it is leading to people becoming hurt, and it cannot continue. Okay, so we just wanted to set out some data about what patients actually think about their experience with GPs at the moment, because personal anecdotes are one thing, but this data is really powerful. So we've looked at this. This has come from Ipsos Mori, surveys they've been doing every year for the last 4 years. And as you can see, since August 18, the overall experience with GP practices has stayed pretty much the same. But what you can see in the bottom line here is, in terms of patients being satisfied with the type of appointment they're offered by their GP, this has actually increased from 74% in August 2018 to 82% now. You would not believe that if you read some of the articles at the moment that are being written by newspapers. There is a total mismatch between patients' experiences and what is being written in the press and insinuated by some politicians. Could you move on to the next slide, please, Hannah? Thank you. Okay, so I'm just going to talk about this briefly because it's very wordy, but essentially we went out to our network. We speak to over 300,000 people every day online to find out what people's experiences in primary care were at the moment. This is extremely important to us. We speak to a broad community of people and they give us negative as well as positive feedback about their experiences in the NHS. But we were overwhelmed by positive stories about GPs. Over 350 people shared these incredible stories of how GPs have gone above and beyond throughout the pandemic. This is just one example which we decided to highlight. So it says, I found a lump in my neck in July 2020. It was a stressful time for my business as I was struggling due to the pandemic and other things going on. I phoned the GP surgery at 8:30 when they opened for emergency appointments. By 9 AM, I was in the car park and had an appointment for 2 days later for a scan. After nearly a year of treatment, the cancer has gone and I'm slowly getting my life back together. Without the quick actions of the GP, it could have been a lot worse. So it's just one, positive story of how a GP has helped. But like I say, it's been absolutely unbelievable seeing the positivity that has come from patients. Could you move on, please, Hannah? Thank you. In addition, telephone appointments aren't new. They're certainly not used only by GPs. They're used across the health service. They've been used for a long time. In fact, in July 2020, Matt Hancock himself said that all GP consultations should be remote by default. And it was doctors who pushed back against this. The Royal College of GPs said that it wasn't always best for patients and that, a mixture of approaches was what would be best for patients. So it's a bit of a shock for GPs to have been told vehemently by this health secretary last year that all appointments should be via telephone, and now are told the absolute opposite and in fact blamed for the amount of telephone consultations that have been happening. This next bit is really upsetting and has caused a huge amount of upset online in the forum that we have with doctors. Essentially, over the recent months, the abuse levelled at GPs in particular has been escalating from patients, many of whom are quoting things from the newspapers and other media sources, often which are inaccurate, and people who are frustrated, anxious, and often healthcare seeking, and so are not feeling well, are reading things in the paper that simply aren't true and then turning up to their GP surgeries and abusing NHS staff. It has been getting worse and worse. We as an organisation have been reaching out to leaders across the UK since early this summer, trying to encourage them to run a public awareness campaign about what is happening, the pressures on the service, and explaining where patients should be going to seek healthcare. For example, what they should go to a pharmacist for, what they should go to their GP for, what they should go to A&E for. It's incredibly important. And yet, despite all of our efforts, we actually haven't received an awful lot of support or interest from those healthcare leaders. It is going to fall to politicians and it's going to fall to journalists to push for this because the public are scared. They are being fed misleading information and now staff are being abused. Now, we have included a screenshot of something deeply upsetting, as well as a lot of verbal abuse, a lot of examples of physical violence. A few weeks ago, a GP had their skull fractured by a patient in an attack in Manchester. A patient was deeply frustrated, felt they weren't being listened to, and launched an attack on 4 members of staff, and the GP present has a fractured skull now. It's really upsetting. It's really scary for GPs because GPs are public facing at all times, and quite frankly, and I don't mean to sound sensationalist because we try to avoid that at all costs, but honestly, I'm very concerned that a situation similar to what happened to Joe Cox could happen to a GP, and we cannot allow that to happen. GPs are not the problem here. The BMA did a survey in August 2021 to try and set out what was going on. As you can see, half of GPs reported verbal abuse in the last month. 1 in 5 GPs reported being threatened at work. 67% have witnessed violence or abuse, and 67% of GPs said that this has got worse in the last year. Could you move on to the next slide, please, Hannah? Thank you. Okay, so I'm going to stop talking now and I'm going to hand over to 3 of our GP members. But I suppose I just want to conclude by saying that there is a problem in primary care. We don't have enough staff. Doctors have actually been flagging this for years and trying as best we can to let politicians know that things need to change. Our primary concern is the welfare of our patients in the NHS. We are very concerned that there is underfunding and a lack of long-term planning, which is going to resource the NHS properly to safeguard our patients. However, staff shouldn't be scapegoated. We need to come together and think of solutions that are going to keep everybody safe. So I'm going to hand over now to Emily, and thank you ever so much for sticking with this and giving us your time this morning.
Hi, yeah, as Julia said, my name's Emily Ball and I work in a practice in the leafy suburbs of Liverpool. Where I work is really rather middle class, well educated, and you would think that it was a group of people who were capable of enough critical thinking to realise that an entire group of people don't suddenly wake up and decide to behave in a perverse manner overnight, but apparently they aren't. So where I work, we have staff, really quite experienced, quite tough staff, reduced to tears on a regular basis, multiple times a day. Before now, we've actually had to staff reception with clinicians because the staff have had to go and walk away and have a cup of tea for 5 minutes and calm down and be debriefed. You get, you don't care, you're lazy, you're all hiding, it'll be your fault if ... whatever it may be. You know, that's difficult to stomach. It's kind of death by 1,000 cuts, you know, and I think that's the problem, is that it doesn't have to be a big attack like Manchester to be spectacularly damaging. But I think more worryingly is what they quote, and they will say, my MP says I can demand to see a GP. They say X paper says I'm entitled to this. The Prime Minister says that you're not doing anything. The consultant I saw says blah, blah, blah. So, you know, things that are put on social media or in the public domain, patients listen to, and they take that in and they quote that back at us. So if it is inaccurate, or if it is simply being simplified by the person putting it on, unfortunately, it just further fuels the abuse and gives them something to say. So 2 particular examples of kind of more extreme behaviour that we've had. We had a person who wasn't even a patient at our practice, turned up demanding to be seen, said they were unwell and needed antibiotics, and when they were politely turned away on the grounds that they weren't even registered with us, they kicked the door in and followed the member of staff down the corridor. The police were called and they came out and they arrested him, but they did not charge the person. And the reason they didn't charge the person was because they claimed that they had simply banged the door in frustration and it had given in. And they couldn't do anything about the fact that they'd followed the member of staff down the back corridor, because apparently the GP practice is seen as a public space. So that didn't really fill anyone with confidence. We then had a second episode where the relative of a patient came in to collect something on behalf of a patient, and they were rattling the screen doors to try and get physically at the receptionist, screaming and shouting. The receptionist had to be sent home, very distressed. But actually, do you know what? We didn't bother ringing the police because we knew they wouldn't do anything. And that's the situation we are currently in. So the outcomes, and what I think that we need to be very concerned about, is that we have an increasingly demoralised workforce. And this is a workforce that is absolutely on its knees just with exhaustion from having worked all the way through the pandemic and in these new ways of working and absorbing all the extra work that is being pushed out of secondary care, understandably. And so, you know, everybody's exhausted and they're now demoralised on top of it. And we are being abused by the very people we are realistically killing ourselves to help, which I think is kind of the ultimate injury. And you have a workplace that is fear-filled. So people come into work and they are already anxious about what's going to happen. And this means a loss of staff and increased stress on those who are left. So at the moment, for example, we have 2 people off sick with the horrible lurgy, D&V, whatever it is that's going around at the moment. And we have somebody else self-isolating with COVID. That's a significant proportion of our reception and admin staff. Now let's imagine that those 3 decide they've had enough and they resign. That's a permanent loss and it's just not sustainable. There is a huge loss of public confidence, damaged doctor-patient relationships, and actually ultimately you are going to get a further brain drain of doctors. We've lost loads of doctors because if you can go to New Zealand or Canada or Australia and have a better work-life balance and a lack of abuse, frankly, why on earth would you not? And you know, the more and more unpleasant this seems like an option, the fewer people are going to opt to go into GP, and the more GPs we already have are going to disappear. So what do we need? Well, we need, as Julia said, clear public messaging, which is honest and open and transparent about what is realistically available within general practice at the moment. People are surprisingly accepting of year-long waiting lists for secondary care. And I think they're being told that that is what it is, and they can understand, because it's in the media, that, you know, overworked hospital doctors can't possibly pull it all back urgently, and we get that. But what they're not being told is actually what it's really like in general practice and what they can reasonably expect from us. And we need some support, actually, some central messaging in support of GPs. We need tighter guidance on zero tolerance policies of abuse of NHS staff, and a tougher stance by the police to deal with it, to try and give both clinicians and administrative staff a feeling of safety back in the workplace, which would be welcome. And we need an urgent overhaul of primary care to define what it actually is. We're not a walk-in centre, we're not an urgent care centre. What we do is manage risk very well and long-term conditions. And we need people to understand what it is we actually do and what it's reasonable to expect us to do. And then we need resourcing to be able to do that. And that has to be a piece of work led by those of us at the coalface, because theoretically there are all kinds of things we could do, but of course reality is always somewhat different. The alternative is that if you get a militant enough workforce, and frankly I think we're probably all too knackered, but if you did, then you are looking at industrial action. Otherwise, you are looking at a continued brain drain, continued burnout, and the slow demise of the NHS. And I'm sure people think that that will never happen, but I'm telling you now, it absolutely will. And we have come extremely close to a complete collapse of our workforce on a number of occasions over the last 2 years. So the abuse for me is symptomatic of a lack of central honesty and responsibility for informing the public about what they can actually do, and a lack of real deterrent. And actually that needs sorting out. And I think the status quo is no longer an option. And I think it would also be remiss of me not to finish by telling you that actually this is extremely time sensitive, that the time for turning this around is in the next maybe 1 or 2 months. Otherwise, it is just going to continue to go down and down and down, because you need one practice to have enough GPs burning out or attacked or off sick or whatever it is. And then they will simply be unable to function. And then the next door GP practice will be forced to take their patients and they will be unable to function. We really are on an absolute knife edge, and I can't stress to you how urgent this is enough.
Thank you, Emily. That's really powerful. We're going to hear from Dr. Alison Hobbs now, who's speaking from Sheffield. We thought it'd be helpful just to set out what a GP does in a sort of average day at the moment to illustrate how busy and how stretched the service is. So welcome, Alison. Thank you.
Thanks. I've worked as a frontline GP for 21 years in an extremely deprived and multicultural area of Sheffield, probably very different to Emily's practice. We've always strived to provide excellent care, and in 2017 we were relatively early adopters of the total triage model of general practice. Now, this model has become widespread during the pandemic, and it involves a hybrid mix of consultations, so phone, online, face-to-face, even the odd video. But the main theme is that the clinician decides the best way to manage the patient request based on clinical need, as opposed to the traditional fastest finger first way of allocating appointments, where if you get through on the phone first or shout the loudest, you get them. This is both unfair and inefficient. And we aim to deal with the bulk of demand same day, regardless of urgency. And we managed well until autumn 2020, but we now find ourselves at crisis point. We've lost clinical staff to burnout, to relocation, to retirement. We're unable to recruit anyone, and we're relying on locums who cost us double and provide less. We are exhausted. Hannah, could you put my slide up? Here's last Monday. I took this picture of our live dashboard at 12:25 when I was leaving my desk to speak to a local counsellor who'd asked me to speak to him on behalf of a patient who was complaining that they couldn't get in to see us. I wanted to show him what my world was like. Had I known it was going on a national briefing, I might have done it on as a screenshot rather than an iPhone shot, but hopefully you get the gist. As you can see, by then we had 259 requests, but as this was Monday, we'd actually had another 39 between 6 p.m. and midnight the night before, so we were at 298. We were staffed to safely deal with 182. We had 8 qualified GPs working that day, but one was only on a 3/4 day as she's recovering from long COVID. And we have 3 very junior trainees. By 6 o'clock, the number had reached 316, but virtually all of those were dealt with that day. Only ones who needed input from someone not working that day were passed on. I started work last Monday at 7:30 a.m. and I left at 8:50 p.m. I had no break other than to meet the counsellor. On the scale of bad days, it was a pretty horrendous one, but by no means exceptional. Although for the first time ever, I actually woke up not 1, but 2 patients ringing them after 8 o'clock. It took me several days to recover. As you're hearing, we're living in a perfect storm of hugely increased and unmeetable demand and a reduced and burnt out workforce. And we're being vilified by media and government, leading the public to believe they are entitled to more than what can be realistically provided. Average funding per patient per year is £150. That's significantly less than most people would spend on haircuts or their pets' vet bills in a year. The system is broken and it's breaking us. Thanks for listening.
Thanks, Alison. That's really powerful as well. And I think sometimes just seeing the numbers, it's really overwhelming even to look at them. And we're not the ones dealing with it every day. So thank you so much for everything you do. And now I'm going to pass over to, well, we know him as Mark, actually. So Mark, could you please share your experiences with us?
Good morning, everybody. Yes, my name's Mark Thornton. It's a family tradition to use the second name. So my brief was to discuss the uses of different consultation methods, and that's actually very simple. We have face-to-face consultations, we have telephone consultations, we have video consultations, and then we have a variety of online consultation tools that different practices use in different ways. But the story behind this really that I wanted to bring to everyone's attention is actually, what is a consultation? Well, a consultation is a period of time during which the GP practice delivers services, and that's actually what we're all contracted to do. It's a general medical services contract. We are contracted to deliver services, not appointments. Okay, so which services do general practices deliver? Well, my brief list here, we deliver acute illness services, so people who are unwell wish advice from us. We deliver chronic disease management. We deliver chronic disease exacerbation management. We deliver contraceptive services, shared care arrangements with hospitals and other places. We take smears. We do NHS health checks. We check people's warfarin levels. We do work with learning disabilities, residential and care homes. We do lots of different types of work with children, including vaccinations. We also do vaccinations for adults. We do vaccinations for COVID, flu, and so on. We are the keepers of the medical record. We generate reports and paperwork for insurance companies and other organisations for patients in our care. We do blood tests, we do dressings and 1,000 other nursing functions. So the question is If you want a consultation, who do you want a consultation with and what do you want it for, and how do we sort out who gets those appointments? Because we have GP partners, we have GP trainees, we have salaried doctors, we have nurse practitioners, we have frailty nurses, we have first contact physios, we have clinical pharmacists, practice nurses, healthcare assistants, social prescribers, to name but a few. So that's how we deliver services with staff and consultations. So general practice is a very, very complicated place. And what we need to do, as my colleagues have previously said, is work safely, and we need to get the right patient to the right clinician, because not everybody can do everything, and we need to have a rough idea of what the patient's needs are before we can appropriately allocate them to a consultation where we deliver a service. Now, the new mantra in the NHS at the moment is working to the, quote, top of your license, unquote. So that means me, as a very senior and experienced GP, should be dealing with the difficult and complicated cases that are coming into the practice. And it's not necessarily the best use of my time to be seeing Mrs. Bloggsy's bunion. Now, that in itself is a process that can generate some friction, because Mrs. Bloggs feels she has the right to see me face to face because I am her GP. And that is on one hand very true, but on the other hand, when you have a service under the most enormous pressure, we're having to be fairly brutal about the decisions that we're making and how we're delivering care with the staff that we have. Now, if we go back briefly to my list of staff that we have, GPs are in very short supply, as has been well highlighted, and it is a woeful failing by several governments. We're short of nurse practitioners. They're in very short supply. Frailty nurses, so basically a new role that we've created for our peculiar practice needs. First contact physios, again, in very short supply. Clinical pharmacists, even shorter supply possibly than GPs. Practice nurses, again, high turnover because it's so busy. So it is not easy to fill our rotas with staff, and that's before we've even considered where we're going to put the staff, because a great many general practices in this country do not have adequate premises. They do not have enough rooms to put the staff in that they need to service their contract because of the number of patients that they have. It's a nightmare. Everything needs to be simplified. The government and the Department of Health need to have a good look in their collective nails and ask themselves, are they being fair and reasonable to the staff who are working in the health service and to the British public? I'm afraid my conclusion is that they are currently not. It's a complete mess, and we need to do whatever we can to sort it out. My contribution is coming here today to speak to you and try and share my experience from 1994 to current regarding the mess that we're in. And, things need to change. I'm more than happy for people to come see what we do in Lincoln and see what a mess we're in. So that's what I've got to say. Thank you.
Thanks, Mark. We really appreciate it. And I suppose we would like to thank everybody who has come today, because you're clearly concerned as we are, and we really appreciate your attendance. We're going to move on to a Q&A session now. So if you've got questions for anyone who's spoken today, please pop them into the chat box. We've got a couple of questions in there already, so I'm going to kick off if that's all right. So first of all, Daisy Cooper, thank you for submitting this question. So Daisy has asked, I joined a briefing meeting with my local CCG. They said that people could always get face-to-face appointments if they want one. So I'm afraid I've been saying that to some constituents because the CCG had said that was the position. It appears that there are crossed wires here. Emily, would I be able to ask you to respond to that? Because I think you probably are in a better position than I am.
Yes, certainly. Yeah, I think the difficulty is, I think, the word want. And I think the issue is not that people can have what they want, it's that people can have what they need. It's been the case within the NHS for quite a while now. with kind of the rationing that's had to go on with procedures of low clinical priority, etc., that, you know, for some time people have not been able to have what they want. They can have what they need. So yes, I think that's I know what you're saying, and we've had the same argument with our CCG, and I know that that's happened up and down the country, is that unfortunately, if you aren't very, very careful with your words, this is what happens, and people will pick up on that. You know, I want an appointment with my GP and I've been told that I can have one. Now that's not your fault. It is what it is. But I think that's where the difficulty is. You can have a face-to-face appointment if you need one. The issue, I think, is, and I just, you know, I see the recent events that have said that actually we're not going to have any social distancing in practices anymore. That's just come out this morning, I think. But of course, the issue is, you know, as Mark said, a lot of the estates aren't fit for purpose, and therefore a waiting room that would usually hold 30 people with social distancing will hold maybe 8 or 10. And it's all very well and good as being told that actually you don't need to social distance anymore, but I'm really sorry. Some of my patients have really quite severe immunosuppression, either due to trying to control a condition, or because of the condition, or because they're on chemotherapy. I cannot have them sat next to a 7-year-old going to school unmasked with a streaming nose and a cough. I can't. It's not safe. You know, it's not safe, and it's a dereliction of my duty to that patient. So we can be told that we shouldn't have any social distancing, but morally and ethically, there's absolutely no way we can do that. I mean, you just can't. It's indefensible to do that. And so because of that, that means that actually it's very difficult to have a waiting room full of people who want a face-to-face appointment. They just can't do it. And I think, again, it comes down to that thing about saying, look, chaps, we have to be responsible, because it's all well and good saying I don't have to wear a mask, but the reality is you will kill somebody. You may never meet them, but you'll kill them. And we have a duty of care to our patients to make sure that doesn't happen on our grounds, actually. So I think it's never quite as simple. And I think the problem is that when the CCG come out with things like that, of course, the other problem is that 9 times out of 10, it isn't the clinicians on the CCG that say that. It's the administrative staff who don't actually do the day job. So they haven't perhaps understood how important the nuances are, I guess. So I hope that answers your question. I've waffled a bit, sorry.
Thanks, Emily. And I suppose what I would add to that is you get the service that you pay for. This government and preceding governments, so it's not, you know, this isn't the only government who've squeezed funding from the NHS or made changes over the years. But if you're trying to make cutbacks, then you can't be surprised when the service is cut back. And frankly, that's what's happened. Clinicians, doctors are taught at medical school to keep patients safe. And so safety is the #1 concern. Safety doesn't always feel great. And as Emily says, you're balancing hundreds of different competing concerns, competing patients. And frankly, it's keeping patients safe, which is at the forefront. This narrative, which is being perpetrated by some media outlets of you should get what you want, is really unhelpful given the pressures, and the pressures aren't being reported on, the lack of GPs, etc. And we just need some honesty, to be honest, about what's going on in the service, which is what we're hoping to do. So the second question has come from Ella Pickover from the Press Association. Oh,
Julia, sorry, it's Mark.
Oh, hi, Mark.
Sorry to interrupt. Yeah. There is also a contractual issue here, okay? And please remember, GMS contract says if you hold a GMS contract, you may deliver the services how you see fit. Okay, CCG and NHS England may deliver guidance that they would like us to follow and things that they would like us to change. But the bottom line is, as a contract holding partner, if I feel it is safest to deliver my services over the period of the pandemic by restricting open access to face-to-face appointments, that's what we have had to do. as Emily says, to keep the service safe, but we have the right to do that because the contract says we can. We're not trying to be difficult. We're just saying this is the way we, as experienced healthcare professionals who have spent our whole lives doing it, feel we have to do this at the moment because these are extraordinary times. What we found is that telephone triage or triage of the patient before they arrive in an appointment has helped us be much more efficient. But the contract says we can deliver services how we see fit, as long as we are delivering them well in a safe environment by staff with the right qualifications. And there are very many regulatory organisations keeping a very close eye on all of that.
Yeah, thank you, Mark. Yeah, it's very good point. I've had some feedback from Daisy Cooper saying, thanks, anything you can do to ask CCGs to be more specific with their language and guidance would be appreciated. Some of the problem we have, Daisy, is that I think GPs are providing that feedback for CCGs. It's not happening, and there is a mismatch in what the government is saying and what NHS England are saying, and there's a miscommunication going on, and GPs are becoming the scapegoat because they are the people who are public facing and they're being blamed in the press. So absolutely CCGs need to be receiving that message, but I don't think it should always fall to the clinicians to have to do so. We're going to move to question number 2. So this comes from Ella Pickover, who's a journalist who's with us today. Thanks for joining us, Ella. Ella says the main debate seems to be focused on face-to-face versus telephone and video consultations. Have your patients expressed a preference? Could I ask Alison to answer this question?
I would love to answer this question, Julia, and I'm also going to try and share my screen. Oh, I can't. Okay, I'm not allowed to share my screen. I've got a lovely graph up for you, but because we have, as I said in my presentation, we were early adopters of total triage, so we've been at this for 4 years. So our patients have had the option of requesting what sort of appointment they want for 4 years. And we've seen how it's changed. And I'm looking, I can't show you, but I'm looking at the live data over the last 8 weeks. And roughly, patients want 10% of them want a face-to-face consultation. So the numbers are 9, 7, 7, 10, 9, 10, 9, 11. So that's what our patients are asking us for. Okay. Now, pre-pandemic, because I'm a geek and I like all of this stuff, I could find the figures for you. Pre-pandemic, it was around 45–50%. So that's a change in the way the public want to come. So it totally backs up what Emily's saying. People are frightened. They don't want to come into a crowded room where they might get something. If they think it can be done remotely, they would prefer for it to be done remotely. And like most of the country, both clinicians and patients, people are realizing that remote consulting is an efficient and safe way of doing things. And the patients are understanding that too. The interesting thing is the flip side to what we actually gave. So in those weeks, what we actually gave, these are the face-to-face consultations, were percentages 11, 11, 12, 12, 14, 14, 15, 16. So in fact, we are actually offering more face-to-face consultations and delivering more face-to-face consultations. And this is just with GPs. This is not people being booked in to see a healthcare assistant for a blood pressure check or something like that. That's purely GPs than the public are asking for. And that is what is not coming across in the media. And that is what is so frustrating. If you want to come and talk to me as a GP who has been doing this for 4 years, we went to this method of working to deal with the fact that we couldn't cope with a fastest finger first appointment system. It's not fair and it's not efficient. This is fair and this is efficient, but it is broken because somewhere upstream the dam burst. The demand went through the roof. Again, I've got loads of figures to prove that. The demand went through the roof 12 months ago and it has not come down. And we have an exhausted and burnt out workforce trying to deal with that.
Thank you. Thanks, Alison. That really sets it out really clearly. Okay, our third questions come from Margaret Greenwood. Hi, Margaret. Margaret's asked, does the panel think there is any relationship between high student tuition fees and workforce shortages? I mean, this is a really broad question. It probably deserves its own briefing, in all honesty. I definitely think that medicine is a very long university course to take for anybody, and the student tuition fees are really high now. We do hear concerns from newly qualified doctors about their ability to pay off their student loans. And certainly there are not enough children coming through, getting into universities who've come from disadvantaged backgrounds. It's certainly something that needs to be addressed. But I think the workforce also needs to be thought of in terms of who's currently working and the support that those individuals are receiving. And what we're seeing at the moment is a leaky sieve type situation where it wouldn't matter how many doctors you trained, some will go abroad or choose not to work clinically at the moment because the situation is so stressful. There's a lot of attacks in the papers as well about doctors retiring early or, going part-time. I mean, the realities of that is that doctors work a huge number of hours per week. And so what's termed as part-time or 3 or 4 days a week for a doctor is still often more hours per week than your average person would do in a full-time job. But we do have a situation where lots of doctors and other healthcare workers are moving abroad, and it's because we cannot offer in the NHS currently a similar sort of support system and lifestyle as healthcare workers enjoy overseas. And some people are voting with their feet and leaving. So as well as sort of focusing on recruitment of new doctors and training lots more medical students, we need to look after the current workforce and avoid or sort of limit this brain drain that other people have discussed during this presentation. I don't know if anybody else has anything they wanted to add to that.
Yeah, could I just jump in here?
Yeah, sure.
I think, if I can just do my granddad thing and go back to when I first joined general practice, actually getting appointment system sorted was quite simple because there was me and there was the other GP, and then we had our practice sister. So you had to make no, whether you were an old, young child, whether it was a backache or a, something more complicated, you saw the GP because that's all there was there. But now in my practice, I've got 8, 9 different types of clinician. And consequently, it's a much more complex environment to try and, sort out who's going where and when. So, you need to bear in mind that the general practice workforce of today and tomorrow is not even probably going to be 50% doctors. It's going to be doctors with all the other people, the nurse practitioners, the frailty nurses, the clinical pharmacists, first contact physios, mental health specialists. We may get a situation where we've got essentially staff grade doctors who used to work in hospitals doing sessions in general practice. That's the way it's going. So don't get hung up on the number of GPs that we need to run the service. It's not, I prefer to think about clinicians. So we have a multi-skill, we at our practice, basically we've got a multidisciplinary team now. And that's the way general practice is going to have to be, because even if you miraculously tomorrow could train enough doctors to fill all the general practice training schemes in the country, to get those 5,000 extra doctors ready in the next 2 or 3 years, they would still be 2 or 3 years from being experienced GPs who can take the lead in practices and replace people like me who will be retiring in the next 4 or 5 years. Otherwise, the continuity of care gets completely lost. So you do need to make sure you've got enough people going into general practice to maintain that apprenticeship, essentially, of going from being a junior GP to an experienced senior GP. But you've also got to remember that only half of the staff in the general practice of the 2030s is going to be doctors, if that.
Yeah. Okay, thank you. Yeah, that's really clear, Mark, and it's a really good point as well. We do have a really changing workforce at the moment across the NHS, actually. Okay, so that's the end of the questions that have come into us. So we would just like to thank everybody who's attended. If anybody has any questions for us, please send us an email at campaigns@everydoctor.org.uk and we'll try and help. We're always really keen to help any parliamentarians or journalists with any work they do, any research. We would love to assist you however we can. So thank you ever so much for your engagement today. We really appreciate it. You know how busy you are. We also appreciate that at the end of the pandemic, you are probably being bombarded by lots of groups trying to speak to you about a huge range of concerns, and ours is one of those. So we really appreciate your attention today. Thank you so much, everybody, and bye-bye from us.